Welcome everyone. We're about to get started in a few moments. Please feel free to introduce yourself in the chat. Well, we just hit 1 o'clock, so we'll go ahead and get started with today's webinar. Can we pull the slides up, please? And welcome everyone to this information session on the Housing and Services Partnership Accelerator. And just 1 second and we'll get the slides pulled up. So my name is Ryan Elza, and I'm the Interagency Housing Innovation and Strategy Lead within the Office of Interagency Innovation at the Administration for Community Living, which is an operating division within the U.S. Department of Health and Human Services. And I will be serving as our facilitator today for our webinar on the Housing and Services Partnership Accelerator about our 2025 opportunity. I'm also really grateful to have my partner, Lisa Kaufman, who's joining me today, who will help guide us through some of the information. So thank you for all of your collaborative efforts, Lisa. Next slide, please. And then next slide, please. So first, a few housekeeping items we want to address. This meeting is being recorded, and by staying to participate, you are consenting to the recording. Also, all attendees have been muted for audio quality. One of the hallmarks of our webinars is active participation from attendees, so feel free to introduce yourself in the chat. Please frequently use the chat to make comments and submit your questions at any time using the Q&A feature in the Zoom dashboard. Or you may email a question or comment to the hsrc@acl.hhs.gov, and we reserve some time at the end to address your questions. You can also use the chat or email if you have technical issues or comments for other attendees. Finally, near the end of the webinar, we'll be using both QR codes on the screen and links in the chat to share some resources, so consider having your phone handy after the webinar. The slides and the recording will be posted on the HSRC website. So bookmark our what's new for updates. Next slide, please. Also, a few notes on accessibility. ASL interpreters. Today, an ASL interpreter will be visible throughout the webinar. You can enlarge the window of the ASL interpreter by using the pin feature. Simply click on the ASL interpreter's window and select the pin icon to make their window larger. To ensure that the ASL interpreters will be visible in our webinar recording. We've also asked presenters and panelists to limit use of their own camera visibility to when they are speaking. And screen readers, for those of you who are using a screen reader and want to silence unwanted chatter in the chat and Q&A boxes, activate the speech on demand feature by pressing Insert Spacebar, then the letter S on the keyboard. Next slide, please. Now, let's take a look at our agenda for today. We've got a lot to cover in a little bit of time. So first, we'll have some opening remarks, and then we will walk through the Housing and Services Partnership Accelerator Opportunity. We'll give you a little bit of background about the program, changes to our 2025 cohort, and talk about the application and the program. Then we'll walk through components, core team members that will be required as a part of the application, talk about a new feature this year, which is our community of practice, and then talk a little bit about the eligibility requirements, our application and selection criteria, and then key dates. And then we'll open it up to questions. Next slide, please. And with that, I'm going to turn it over to my colleague, Lisa Kaufman, who is the Senior Advisor within the Office of the Deputy Assistant Secretary for Special Needs at the U.S. Department of Housing and Urban Development. And with that, Lisa, the floor is yours.
Thanks so much, Ryan. It's so good to be with you all today. I've just been watching the chat. There is such a diverse representation here today. We have a number of service providers and housing and homeless providers and aging and disability groups and centers for independent living. So I'm just so pleased that we have this group here today. So thank you all for taking the time, and we hope that the information that we present will be valuable and informative to you all. So next slide, please. So just to give you just some framing before we get into the bulk of the discussion, it's no surprise to anyone on this webinar that the lack of affordable and accessible housing is a primary cause of homelessness. We know that many people experiencing homelessness or who are at risk of homelessness are folks with disabilities, older adults, or people with behavioral health needs. And for these people, housing alone is not enough to support their ability to live stably housed in the community. So wraparound supportive services are instrumental in achieving our shared goal of housing stability and ensuring full community participation and integration for older adults and people with disabilities. So to help bring together HUD's housing sector and ACL's Aging and Disability Network, in 2021, HHS and HUD launched the Housing and Services Resource Center, or the HSRC, to leverage the expertise of the housing and homeless sector with the aging, disability, and behavioral health sector to come together to really stand up important partnerships for housing and services for these key populations. So I'm now going to turn it over to Ryan, who's going to talk more about the HSRC, and then to get more into the discussion about the accelerator partnership. So thank you all, and we look forward to answering your questions.
Thanks so much, Lisa. And we are so grateful for our partnership with HUD and our other sister agencies within HHS and other federal departments for the Housing and Services Resource Center and the Housing and Services Partnership Accelerator. And as mentioned by Lisa, the HSRC was launched in 2021 as a partnership between HHS and HUD. And really the goal is to foster cross-sector partnerships between organizations and systems that provide housing resources and homelessness services, healthcare and mental health services, independent living services, and other supportive services. And the HSRC is part of an initiative to really streamline and expand access to affordable, accessible housing and the critical services that make community living possible. Next slide, please. In its 3 years of existence, the HSRC has grown to a cross-sector federal team led by ACL that also works very closely with our colleagues at HUD. Next slide, please. But the HSRC is far from an insular federal convening. It partners with states, tribal nations and organizations, local governments, disability and aging agencies and organizations, homeless advocates, substance use disorder and mental health providers, homelessness continuums of care, public housing authorities and housing providers and developers. And there's a wide array of agencies and other organizations that deliver housing services and healthcare. And it's important for all states to consider partnerships across sectors with these agencies and organizations, especially those that are directly delivering services to people at risk of or experiencing homelessness, older adults, and people with disabilities to achieve community living and housing stability. Next slide, please. All federal agencies now recognize that an individual's health is impacted by factors outside of a clinical context, which we refer to as health-related social needs, or more commonly known as the social drivers of health, such as food insecurity and housing instability. In response, governments at all levels, nonprofits, and corporations have been working to create bridges between housing, healthcare, and social care. At ACL, we know that housing stability for many older adults and people with disabilities require having a safe, accessible, and affordable home, access to an array of health services, home and community-based services provided through entities such as the Aging and Disability Networks. HCBS help people with mobility, functional, or cognitive difficulties to live independently and stably in the community. In recent years, we've been engaging a wide array of federal partners to better align housing, health, and social care for our populations. Together, with many other federal agencies and departments, we've been embedding incentives for multi-sector collaboration across housing, health, and social care programs. Furthermore, our sister agency, CMS, has been expanding the ways that Medicaid and Medicare funding may be used for health-related social needs, including housing. Over the past decade, leaders at all levels have increasingly recognized the critical link between housing and health. This progress is reflected in the use of terms like health and housing in policy discussions and the implementation of community transitions, illustrating the growing acknowledgement of this intersection. Efforts to integrate housing, health care, and social care, such as Medicaid partnerships with community-based organizations and 1115 demonstrations, have provided valuable lessons on workforce management, system integration, and data sharing. And these advancements have informed new federal policies and frameworks aimed at addressing health-related social needs, or HRSNs. In addition, guidance has been released for in lieu of services for HRSNs in Medicaid managed care, and CMS has released new rules, including screening measures for hospitals, physicians, special needs plans, advanced payment incentives for Medicare ACOs, and new codes in the physician fee schedule final rule. Next slide, please. Access to safe housing, healthy food, and transportation and other basic needs have significant impact on a person's health, their ability to maintain their health coverage, and connection to their health care provider. In November 2023, CMS published guidance on opportunities to cover clinically appropriate and evidence-based services and supports that address HRSN, and a framework of services and supports that CMS considers allowable under specific Medicaid and Children's Health Insurance Program, or CHIP, authorities. This builds on previous guidance and brings together policy from recently approved Section 1115 demonstrations, providing direction and encouragement for state partners to realize these opportunities. This innovation supports the core goal of connecting people with evidence-based interventions and partnering with housing and social service agencies to improve access for individuals with specific clinical conditions. On this slide, you can see examples of housing-related supports and services. And these are services such as pre-tenancy services, including transition and navigation services, which are things like finding and securing housing or one-time transition and moving costs. Tenancy sustaining services that include individualized case management, and also linkages to state and federal benefit programs, benefit program application assistance, eviction prevention and tenants' rights education, home remediations, such as air ventilation improvements and mold and pest removal, and home and environmental accessibility modifications, such as wheelchair accessibility ramps, handrails, and assistive technology. Next slide, please. So an initiative of the Housing and Services Resource Center, the Housing and Services Partnership Accelerator, or HSPA, was launched this past year to help states align housing, health, and social care through technical assistance to support their implementation of new Medicaid-covered housing-related services and supports. The HSPA responds to states' requests for assistance to tackle a common set of issues, including payment models, rate setting, alignment with federal and local housing assistance programs, building provider capacity, partnership development, and data integration and sharing. The HSPA is a peer-to-peer learning collaborative focused on building partnerships across health, housing, aging, and disability to support states and local communities to braid the array of federal resources, including Medicaid, to help people at risk of or experiencing homelessness to obtain and maintain stable housing and supportive services. States have a unique opportunity to take a whole government approach to address housing stability by emphasizing greater collaboration and coordination across sectors to optimize resources, cover resource gaps, align state and local policies, and deliver more integrated and seamless services. And the reason is because we know that the coordination of housing assistance and wraparound supportive services, such as in the form of supportive housing, is a proven cost-effective approach to assisting older adults, people with disabilities, people with chronic and or complex health conditions transition from homelessness, exit or avoid institutional settings, and live in the community. Next slide, please. And this illustration will give you a high-level sense of how housing, health, and social care partnerships can support older adults or people with disabilities with exiting homelessness or an institutional setting. The top arrow shows the funding streams that can be braided together to provide a seamless set of services and supports for individuals in the community. Green, you'll see the arrow there, is the Medicaid or managed care funding for not only healthcare, but also pre-tenancy and tenancy sustaining services, as well as in-home services. In red, you can see funding from agencies such as ACL or SAMHSA and other sources that community providers can use to support outreach to help people who are unhoused and to provide an array of supplemental services and home and community-based services. And in blue, you'll see you have rental assistance that could be provided, such as in the form of a voucher from a PHA, homeless continuum of care, or other source. Ideally, all three types of support, housing, health, and social care, are available and coordinated as an individual journeys from homelessness or an institutional setting to housing stability. The lines are dashed because the mix of supportive services should be responsive to the individual's preferences and needs in a housing-first approach. And the mix of available supports in the community varies. And this type of model succeeds when the three sectors closely collaborate so the period of homelessness is brief and one time. Next slide, please. This past year, through a competitive process, 8 states in the District of Columbia were selected to participate in the inaugural Housing and Services Partnership Accelerator. These states formed multi-sectoral teams to bring together aging and disability, housing and homelessness, health, including behavioral health, social care, and Medicaid. You can learn more about the 2024 HSPA cohort on the Housing and Services Resource Center website, where you'll find access to recordings of the learning track sessions that were held with states, resources developed through the accelerator, and recordings of previous national webinars in which we highlighted lessons learned and successes from the states who have been participating in the peer-to-peer learning across this past year. Next slide, please. So we're really excited to be able to offer a new cohort of the Housing and Services Partnership Accelerator that is made possible through our strong collaboration and partnership with our colleagues at HUD and also our other federal agency partners such as SAMHSA, CMS, ASPE, among others. Next slide, please. Under the 2025 cohort of states, there are a few changes to note about the program and the application process. First of all, we have expanded the required core team members, and we're going to talk a little bit about that later in today's presentation. There will be a partnership assessment that each state will complete and send as an attachment to their application that explores what partnerships your state and communities have established, which they intend to establish, and to what extent each team member is involved in the implementation and the implementation of housing-related supports and services. And we are also pleased that we'll be offering a community of practice to our 2024 and 2025 HSPA cohort states, and we'll talk a little bit more about that later. And we are also expanding an in-person convening for participating states. Last year, we held a 2-day in-person convening. This year, we'll be expanding that to 3 days in the DC area, and we'll share a little bit more about that. And of important note, there are changes to the application process itself, which we'll cover in depth in a minute. And each state will be required to complete a simple letter of intent and a partnership assessment with their completed application. So next slide, please. So the Housing and Services Partnership Accelerator will operate for 12 months starting from January through December 2025. States selected to participate in the accelerator will need to commit the time and resources to leverage this opportunity to its fullest. So the individual components and activities of the accelerator are listed here. So we will have one virtual kickoff meeting. Each state will have a state needs assessment that will be completed, that will help us fully understand a state's specific technical assistance needs. This state needs assessment will be completed by the coaches that will be assigned to work with each of the states. We will have one in-person convening that will take place in the Washington, D.C. area, that will include federal and national subject matter experts. Travel expenses will be covered for the Housing and Services Partnership Accelerator core team members from each state. We will have up to 8 peer-to-peer learning track sessions throughout the year. These are 90-minute sessions that are interactive peer-to-peer learning opportunities in which states share the challenges that they are working through, their best practices that they've learned relative to these specific issues, and also the opportunity to really do some creative problem solving together. There will be one-on-one state coaching with support from housing and services subject matter experts. So each state will be assigned 2 coaches, one who is a housing expert and one who is a services subject matter expert. There will be a community of practice for aligning housing, health, and social care at the community and local level with learning tracks that really target cross-sector partnerships of entities such as continuums of care or COCs, homeless service provider organizations led by people with lived experience, public housing authorities, local area agencies on aging, centers for independent living, community care hubs, hospitals, and health systems. And we will also have a final closeout webinar that will be a national webinar to share lessons learned over the course of the accelerator so that other states are able to learn from the experiences that states will have over the course of this next year. And states are expected to dedicate at least one key staff from each of the core team member entities, and we'll talk about them in a minute. And at least one key staff from every participating agency or organization listed on their application to participate in these activities. Additionally, states may want to dedicate time in between the learning track sessions to debrief on their learnings and share with others within their state. Next slide. So this learning collaborative will bring together states who are interested in implementing or expanding innovative housing-related activities, supports, and services targeted to Medicaid eligible persons with disabilities, older adults, and persons at risk of or experiencing homelessness for peer-to-peer learning activities. And only states with an approved 1115 demonstration or 1915I state plan amendment covering housing-related services and supports will be accepted, and only one application from each state will be accepted. Next slide, please. For 2025, states will need to develop a core team comprised of at least one representative from each state agency and community and or local partner agency listed on the slide here. So for state agencies, your team will need at least one member from the state Medicaid agency. And please note that at least one required participant must be the staff working on the administration or implementation of Section 1115 or 19 or Section 1959 state plan benefits identified in your application. But additional participants are optional and may include other staff from state Medicaid operating sister agencies, such as Money Follows the Person demonstration staff, state staff Medicaid agents, finance, budget staff, among others, a state aging agency, a state disability agency, a state housing and homelessness agencies, and the single state agency for substance abuse services and state mental health agencies, as well as the state no wrong door system. Your core team will also need to include at least one representative from the community and local partners list. This includes a a homelessness assistance program or homelessness service provider, a continuum of care or COC program, a public housing agency or PHA, an aging and disability resource center or ADRC, an area agency on aging or more commonly known as a AAA, and a center for independent living or SIL. Next slide, please. In addition to the required core team members, states may also include and are highly encouraged to invite eligible partners such as additional local aging and disability and housing organizations, community care hubs, managed care organizations, state or local public health agencies, federally qualified health centers, certified behavioral health clinics, hospitals and health systems, behavioral health providers, community-based organizations, and other service providers to be a part of the teams, and priority will be given to the states with the most robust partnerships across state and local agencies in the housing, disability, aging, and health sectors. Next slide, please. As mentioned previously, states will have the opportunity to engage local communities through a community of practice that will have targeted learning tracks across aging, disability, housing, and health. And this will have topics with specific peer-to-peer learning sessions, enhance and support community engagement, and it will really focus on aligning housing, health, and social care at that community and local level. And partnership entities include all of the ones that have been mentioned throughout this presentation, but those are entities such as COCs, homeless service providers, PHAs, AAAs, SILs, CCHs or community care hubs, hospitals, health systems, including public housing primary care centers. Next slide, please. So the Housing and Services Partnership Accelerator was established in response to states' expressed needs and will provide technical assistance in a variety of topics, including but not limited to strategies for creating new partnerships or strengthening existing partnerships between continuums of care and other housing entities, aging and disability network organizations, state Medicaid agency and operating agencies, braiding of funding from continuums of care, public housing authorities, Medicaid, and other funding sources for health and community living to link and connect people to housing resources and supportive services, and or to create supportive housing models. Services and benefits designed such as assertive community treatment, community support programs, peer support services, payment models and rate setting, including bundle payment models such as per member per month rates, case rates, and other value-based purchasing strategies. Data strategies to identify and prioritize individuals for housing and other services, including establishing data use agreements and cross-system data matching, and other infrastructure at multiple levels, system, network, and service provider. Strategies to support persons with disabilities and older adults to transition from hospitals, nursing homes, or institutions to stable housing in the community through aging, disability, health, and behavioral health and housing partnerships, and more. The application provides a more detailed list of technical assistance topics, and you are asked to indicate all the topics for which you are seeking assistance through this accelerator program. Next slide, please. So each state will submit a simple letter of intent to apply, a full application, full written application, and the top rated states will be invited to participate in an individual state interview with an interagency panel of federal partners as a part of the application process. So the process is comprised of 3 parts. The first is to submit your simple letter of intent to apply by November 20th, 2024. And this will be completed using a SurveyMonkey link provided in the application. The second is a written application that includes a partnership assessment completed using the application form template on that accelerator webpage. Applications are due to ACL by 10 a.m. Eastern Time on December 20th and must be submitted to the HSRC at acl.hhs.gov inbox. The top rated applications will be selected to participate in that interview that was mentioned, where we will dive a little bit deeper into your state's goals, readiness to participate, and technical assistance needs, and ask any questions we had about the details in your application. And further instructions will be sent to states selected to participate in these interviews. Next slide, please. So as mentioned, states will be required to complete a cross-sector partnership assessment as a required part of your application. Your responses using this form will help the accelerator application reviewers understand your existing partnerships with core team members at the state and local levels and provide context for the technical assistance needs that you will mention within your application. You will be asked to rate involvement across the sectors of aging, disability, housing, and homelessness and health in your state's effort to plan and implement housing-related supports and services. So we'll ask you to do this by self-reporting on a scale of 1 to 5, the level of involvement across these sectors and specific to individual entities and agencies. And then specifically want you to rate how these organizations and agencies have been engaged related to mapping workflow processes and data interoperability, and also any other information that you'll have to share about how they've been engaged in your implementation and planning process. Next slide, please. Using information gathered through the application process, the following criteria will be used to select participating states. So first, we'll be looking at evidence of well-established and currently active Medicaid community living and housing partnerships that provide a foundation for implementing housing-related supports and services. We'll be looking to see that you have an improved Section 1115 demonstration or 1915I state plan amendment covering housing-related supports and services for individuals experiencing or at risk of homelessness. We'll be looking to see that you have clearly identified goals and detailed strategies to improve or expand housing and services for your state's target populations of persons with disabilities, older adults, and persons at risk of or experiencing homelessness. Clear articulation of technical support needs and the specific outcomes that the state wants to achieve within the accelerator technical support. We'll be looking for a designation of a staff member from the state Medicaid agency who will serve and have the time and resources necessary to be responsible for the day-to-day activities. Identification of the core team members, including the state Medicaid agency representative, state housing representative, and aging agency representative, and disability agency representative, in addition to the community and local members identified. We'll also be looking at the degree to which your team includes cross-sector representation at the state and local level in housing, disability, aging, and health. Next slide, please. We will also look for alignment of goals with other relevant housing and services activities within your state. So looking at how there is alignment with things such as your state plan for addressing developmental disabilities, your state aging plan, your state plan for independent living, relevant SAMHSA grant activities, state opioid response task force, plans to end homelessness, and more. We'll also be looking at alignment of technical support goals with other housing and services activities within your state. We'll be looking at the capacity and readiness of your state team to begin working immediately upon selection for the Housing and Services Partnership Accelerator. We'll also be looking for acknowledgement from your state Medicaid director or a letter of support if your lead agency or organization is not your state Medicaid agency. And finally, assurance that team members will have sufficient time and resources for the duration of the track to achieve success within this effort. So next slide, please. So here you'll see the key dates for the 20 and 25 Housing and Services Partnership Accelerator. So as already mentioned, the letter of intent is due November 20th, 2024. The application is due emailed to the HSRC inbox by December 20th, 2024 at 10 a.m. Eastern. Interviews for the highest scoring applicants will take place over January 15th through the 17th. And states who have been selected will be notified by January 31st, 2025. And then we will have the accelerator kickoff meeting with the cohort of selected states in February of 2025. So next slide. Well, we've covered a lot of information in a lot of detail and very quickly. So now we want to take the time to respond to questions that have been entered into the chat. And we know that we might not get to all of the questions, and there may be some questions raised that require coordination across our federal partners to develop a response. We will include answers to all questions raised today, as well as those received via email in an updated frequently asked question FAQ that is available on the HSRC website. The FAQs will be updated as needed to be sure to check them as you're preparing your response and prior to submitting your application. And with that, we'll open it for questions. And I'm going to invite my colleague Lisa Kaufman to join me back on screen to help answer some of these questions. And also while I take a little bit of a drink, because I have something in my throat. Thanks, Lisa. So the first question that we have is, what if your state's 1915I or 1115 demonstration is in the approval process, and you're not sure when it will be finalized? So that's a great question. So in order to apply and be selected to participate in the Housing and Services Partnership Accelerator, you do need a CMS approved 1915I or 1115 demonstration by the time that states are selected. So you are welcome, if you are currently in an approval or pending approval, to submit an application if you believe your application could be approved by the time that the selection process may be completed. But it is required that by the time that by the time of the selection process, that you do have that approval.
Brian, I'll take this next one.
Okay.
Is the HSPA similar to the NASB's Health and Housing Institute that is 24 months of technical assistance? If a state is participating in the Health and Housing Institute, would that be a duplication to engage in HSPA? That's a really good question. So the HSPA and NASB's Health and Housing Institute is working very closely together. We have a lot of alignment with HRSA, and there's a lot of overlap between the two initiatives. So what my answer would be for that is for that state to really have a a discussion to really determine what it is that they're trying to accomplish with the technical assistance that they would be interested in achieving through HSPA, because chances are they would probably be able to get it through the Health and Housing Institute. We found them to be an incredible partner. They're sharing in our learning tracks. There's a lot of cross-pollination with learning between both initiatives. So I don't know that I would say it's a duplication, but we would really want to have a conversation just to make sure that we're leveraging resources and you know, just not you know, not just giving people an opportunity to have access to the technical assistance. Ryan, I don't know if you would add anything to that.
Yeah, no, thank you, Lisa. We've coordinated really closely with our colleagues at HRSA and NASHP, and are excited to continue to work closely with them over this next cohort of the Housing and Services Partnership Accelerator. So there have been a number of activities in which participants of each learning collaborative have been able to come together for different activities. States who are currently participating in NASHP's Health and Housing Institute are welcome to apply to this new cohort of the Housing and Services Partnership Accelerator. But I would echo Lisa's comments to really be very clearly identify of how you would specifically leverage this technical assistance opportunity to really help build on the work that you're doing within your state. So I see a question here is, does the state core team require representation from each of the community partners or just one of those partner listed? So each of the partners that we identified on the core team requirement section and on that slide listed there, you need a representative from each of those community-based organizations to participate. And this is further described in the application and program overview. So next question is, can you further describe how this cross-sector partnership assessment is used in the application selection process? So that's a really great question. So one of the criteria that we walk through in how we're evaluating and assessing each of the applications for the accelerator is the degree and robustness of cross-sector partnerships across aging, disability, housing, homelessness, and health that are currently established. We'll be using the cross-sector partnership assessment to really be the evidence and information that goes into assessing that individual specific criteria for applications. So we're really hoping to get a detailed look and lens about how you have engaged aging, disability, housing, and health, and homelessness entities, and beyond just how you collaborate potentially at the state agency level, but also how you have taken specific action related to community and local organizations as well. So we'll be looking at that assessment to get a better understanding of currently where you are in that process. And, you know, we fully acknowledge that for a lot of states, you may be early in your journey in how you're engaging each of these sectors and how you're engaging some entities within each of these sectors. So we want you to be honest and really just kind of give us that sense of where you are, you know, how you plan to engage those sectors and organizations as a part of this technical assistance opportunity, so that we can really just get a better understanding of the current state of activities as you also share your future state of planned activities.
We had a question about, is there a way to see the progress that my state made as a part of the 2024 cohort? That's a great question. As Ryan mentioned in the beginning, The first cohort had 8 states and the District of Columbia that participated. And we're still at it for the first cohort. We'll be wrapping up here shortly. And we will be publishing summaries and information on best practices and findings from what we've learned from the cohort. So we don't have anything yet, but there will be information to come. So please stay tuned and visit the HSRC website often because we are very excited to share what we've learned in the cohort with you all pretty soon. So stay tuned for that. There's oh, go ahead,
Go ahead,
Brian.
Lisa.
Oh, no, go ahead.
Okay. So if a state is not selected this time, is there a second application period? The application period for the 2025 cohort is set to close on December 20th. It is our intention and goal to continue to be able to offer future cohorts of the Housing and Services Partnership Accelerator. And we would be doing that on an annual basis. So on the next cohort, we would be looking at opening up applications in October of 2025. Although that is subject to funding, and we are firmly committed across our federal departments and agencies to continuing to offer technical assistance in these areas. Do you want to do the next one, Lisa?
Yeah, there's a question on how many states will be selected in the 2025 cohort. It will really depend on we're hoping for it'll depend on funding. We're hoping for up to 5, but it will really depend on resources and funding and the technical assistance that the states are needing. But we're hoping for 5, at least 5 this go round.
Thank you, Lisa. So there's a question about, will you consider if there are housing tenancy services under other authorities, such as a 1915C, for example? So the eligibility criteria to be able to qualify for the accelerator is a 1115, an improved 1115 or 1915I state plan amendment. That includes housing related supports and services. So you must have those specific approved authorities in order to be able to participate. However, those are not the only authorities that you can build into your application. So as long as you have those applications, but if you also have housing intensity services under your 1915C, you can incorporate those into your application for the accelerator and how you're looking at leveraging those as a part of your strategies. But if you only have 1915C, then you would be ineligible to apply.
There's a question about how much will each state receive. So I should probably clarify this. What each state will receive is technical assistance. So it's not as if HHS and HUD will give each state a dollar amount. What each state will receive is coaches. So each state will receive technical assistance experts that will be embedded with them. So they will have issues that they have identified that they want to work on in terms of their implementation, and those experts will walk alongside them for the period of 12 months to help them resolve, address those issues as part of their implementation. So there's not, there's a value of technical assistance that each state will receive, but it's not like we're handing them incredible technical assistance value, but it's not like we're giving states, a wad of cash to do with what they want. So I hope that answers your question about how much will each state receive.
So we have a question about the core team would require one person from each listed state agency and each listed community partner for a core team of a total of 12 individuals? Question mark. So that's a great question. So the core team could include up to 12 individuals if you're having one person from each of those listed state agencies and community partners. But we also know that for many states and communities, some of these agencies or entities might have an intersectionality of different identities that align with, such as a local area agency on aging, may also be your Aging and Disability Resource Center, or could also be a center for independent living. So, and we also have seen examples of local area agencies on aging who serve as continuums of care. So if you have team members who might check off multiple of those boxes, you could have an application in which you have fewer than 12 members, but you do need one person from each of those organizations/entities. So for 2025, you're looking for those states that have a waiver referenced, but have not yet developed a health housing wraparound program through Medicaid. For instance, California is not eligible because it has a program in process. Is that correct? So for the 2025 Accelerator Program, we are opening this opportunity for a new cohort of states with approved Section 1115 or 1915I state plan amendments that have housing related supports and services. So the California did participate in the 2024 cohort. So California would not be eligible to apply to the 2025 Housing Services Partnership Accelerator. However, states that participated in the first cohort will be offered an opportunity for ongoing technical assistance through the Housing and Services Partnership Accelerator. But this opportunity is open to a new cohort of, as Lisa mentioned, depending on funding, up to 5 states. So we have a question of, I understand one of the coaches will be a housing expert, but what was the other coach for? So you'll have a services subject matter expert who will have expertise in developing, designing, implementing services, expertise within Medicaid and other areas within that space. Let me see. Are there other questions? And please use the Q&A function to submit your question. I know some folks may have dropped questions in the chat, but we are reading questions off the Q&A. So we do have a question related to Idaho. So Idaho has an 1115 Medicaid waiver for behavioral health transformation. While not explicit to those experiencing homelessness, it does cover services for folks in the community at home with SPMI/SUD. How do we evaluate if it sufficiently meets the eligibility threshold for an application? So great question. In order to be eligible for the accelerator, covered populations do have to be explicitly at risk of or currently experiencing homelessness. The reasons behind that is we are leveraging funding that is provided by our colleagues at HUD, and I'm sure Lisa can talk a little bit more about this, but through McKinney-Vento, which the authorities related to that funding requires a specific focus on homelessness or at risk of homelessness. So it does need to be part of the covered population under the authority that you're applying. But Lisa, did you want to say anything else on that?
My apologies. I'm sorry. I was typing an answer in the chat.
Yeah, is there
I'm
anything
sorry,
you
I
wanted
missed
to
the
mention
question.
related to the funding, McKinney-Vento, or how we're the focus on homelessness?
I'm sorry, I missed the question.
Oh,
I'm so
they were the specific question was Idaho has an 1115 Medicaid waiver for behavioral health transformation. And while it's not explicit to those experiencing homelessness, it does cover services for folks in the community at home with SPMI slash SUD. How do we evaluate if it sufficiently meets the eligibility threshold for an application? And I was explaining that the criteria for applying to the accelerator is you needed to have um, individuals as the covered population of housing related supports and services under your 1115 or 915 I. It had to be individuals at risk of or experiencing homelessness, and a little bit of the background of the authorities that were using the funding and the authorities related to that.
correct. Because we're using McKinney-Vento funds, it has to, we have to limit the population to people experiencing homelessness or at risk of homelessness, which is why the focus is what we've declared in the application. So that's why we've limited it to the 1915 and the 1115 and the targets that we have. So yeah, so that's the guardrail that we have set up for this competition.
So we are at 1:57. So we're almost out of time. So I'm just gonna, I know we got a number of new questions that were just submitted. So let's see what we can answer before we do the wrap up. So someone asked that you needed an improved 1915 state plan amendment or 1115 waiver by the time of selection. So they want to clarify, does that mean the submission on December or 20th or by January 31st? By January 31st, you will need to have that approval, would be the answer to that if you are currently pending. And with that, I think we're gonna just wrap up today, but any additional questions, we will be sure to provide answers using the FAQ page for the Housing Services Partnership Accelerator. And Esther just dropped it into the chat there. So next slide, please. Well, first of all, once again, I want to thank our partners at HUD for working with us on this to be able to offer a second cohort of the Housing and Services Partnership Accelerator. These resources located on the Housing and Services Partnership Accelerator webpage the program overview, the letter of intent, the application, and the FAQs will be useful in preparing your application. As a reminder, we will be updating the FAQs based on the questions we receive. So please be sure to revisit that frequently as you prepare your application. A recording of today's webinar will be posted to the HSPA webpage. And the QR code on this slide will take you to that page and all of the resources listed here. Next slide, please. And also, we just want to remind you that the Housing and Services Resource Center has a variety of focus areas for learning and resources for action. And you can scan the QR code on the slide to go to the HSRC's homepage. You'll be able to learn more about affordable, accessible housing, tools that provide easy access to directories, to find housing partners, get data, and find housing and services partnership models. And on the HSRC, you'll be able to see recordings of our other previous webinars. So be sure to check out our What's New page to see see what information is updated. And you can also sign up for the HSRC listserv on the website. We have 20,000 individuals and growing signed up for that. And next and last slide. We just also want to remind you that the HSRC is your resource center. So please email us at hsrc@acl.hhs.gov about any technical assistance needs. You might have website suggestions and your own cross-sector partnerships that we can highlight as a part of our ongoing work. And with that, we hope everyone has a great rest of your day and week, and look forward to reviewing your applications in December. Thanks, everyone.